everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section of our course has to do with natural family planning. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and informational purposes only. Content is not intended for substituting for clinical, legal, and professional advice. We strive to keep our information as timely and accurate as possible, but we make no guarantees or promises of the accuracy and adequacy of the information being provided. The course objectives for the natural family planning is just talking about as midwives why this is important for us to understand what exactly is natural family planning, what are the different contraception options out there for our families, particularly for more natural-based, religious affiliated, or just people that don't want hormones in their body and more want to be in tune with when are fertile times and when are not. You want to be able to verbalize the understanding between the different types of natural family planning methods. You want to be able to verbalize the mechanisms in action and how effective are these natural family planning options. And then the last but not least, the advantages and disadvantages of natural family planning. It's important for us as healthcare providers to understand what exactly is family planning. What are the options? What are the position statements? What are our families entitled to have choices about? So there's many types of family planning options out there. There's contraception that's hormonal based. There's pills. There's the Nexplanon, there's the Mirena, there's non-hormonal based ones, there's the condoms, there's the Paragard. There's a lot of options out there with the diaphragm. And then there's the natural family planning options, which is teaching them about their body and reducing the exposure risk of fertility with the ovulation in sperm to create conception. So according to the World Health Organization, family planning is defined as the ability of individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. Importance of family planning is clear from its benefits to individuals as well as a family, community, and society as a whole. Family planning serves three critical needs. It helps couples reduce the risk of unintended pregnancies, helps to reduce the spread of sexually transmitted diseases, and by addressing the sexually transmitted diseases, it helps reduce the risk of infertility rates from those STDs. So there's different types of natural family planning options, but I just want to talk about what are there as far as natural family. There's birth control, there's artificial contraception, there's ways to put barriers up and stop the egg from getting to the sperm, there's ways to stop ovulation with the pills so that the sperm doesn't have anything to fertilize, and that one tends to be a little harder with the Catholic, the Protestant, the religious affiliations with what God's wishes are. So natural family planning is a great option for your Amish, your Mennonites, your religious affiliated families that don't want to have 10, 12 kids. They want to have a nice space in conjunction with breastfeeding using as a contraception method. So natural family planning talks about the menstrual cycle, the times that are fertile, and the times that you're less likely to get pregnant as long as you're not ovulating. What are the different options for natural family planning? There are the withdrawal pull-out method, which is the man removing the penis before ejaculation occurs. It's not as effective because some men don't have strong control over when the orgasm and the ejaculation is occurring. There is sperm in pre-ejaculation, so you can still get pregnant. It's about 87% effective. So if you consistently use withdrawal pull-out method, you'll eventually get pregnant because 13% of the time there is some level of sperm and inaccuracy in that ejaculation timing. With the rhythm method, it's a very great method if you follow it to a T. If you know your body perfectly, you have regular cycles, you know 24-hour window of ovulation, and that sperm can live up to 72 hours. You're not having sex between a roughly 5-day window. So You also can't just use cervical mucus discharge and basal body temperature, because if you had sex the day before, that sperm is still living now that you're ovulating and you're fertile. So it really is important to know your cycles well and anticipate when you're going to ovulate and not have sex 3 days prior to ovulation. Fertility awareness method is what we talked about. You figure out how many days you have in your cycle. Are you a 28-day cycle menstrual rotation, or are you more like 35 days? Because every woman is different. So a lot of the fertility awareness recommendations are day 14, but if you are someone that ovulates closer to day 18, 19 of your cycle because you have longer cycles, you need to customize the fertility patterns and awareness to you. You can use a calendar, but you have to be perfectly consistent with your body of when the cycles come. If you have polycystic ovarian syndrome, you have stress, you have obesity, you have irregular cycles for one reason or another, it makes it very difficult to use natural family planning. Mucus method is a great option, but that's only telling the cervical mucus discharge changes. They're more of a creamy, increased discharge, milky white, and that's while you're ovulating. So if you're only basing it on the mucus method, you're not going to get the timing of potentially having sex the last 72 hours when the sperm is still living. So the mechanism of action and how effective is natural family planning, we'll just do a high-level summary of the options. It's a great option for some people, but some people still get pregnant on it because each person's body is not a computer. It's not science. It's not exact. And it's hard sometimes when you want to be intimate with your partner and to hold off and wait. Sometimes you say, well, this one time it won't matter. If you don't follow it exactly to a science of consistently, regularly avoiding sex when you're fertile, will eventually get pregnant. So the standard day method, it prevents pregnancy by avoiding unprotected vaginal sex during your most fertile times. That's that ovulation window. If it's used perfectly consistently all the time, it's about 95% effective. If you are using it once in a while, obviously the effective rate goes down. It's closer to 88%. Basal body temperature is avoiding pregnancy during your fertile days. Learning your temperature slightly goes up when you're ovulating. There's not as much data to show is this effective, or people tend to use it in combination with other natural family planning options. So there's not a lot of data to say the reliability of strictly just checking your temperature and using that as a contraception option. The 2-day method is just avoiding sex, just simple 2-day window. This is when I ovulate. You still have that chances with the sperm living 72 hours that some people prefer to make it a 5-day window. Some people prefer to make it a 2-day window. It just really depends on your goals and how adamant you are to space your children or avoid an unintended pregnancy. It's 96% effective if used consistently, and it's closer to 86% effective if it's used once in a while. So the symptom combination with your temperature is a little more effective because you're using in conjunction the basal body temperature and the cervical mucus discharge. You're getting the calendar rhythm. You're doing everything in combination. So it's very, very effective if you follow it to a T, avoiding sex during those fertile days, but really using all the symptoms in conjunction to be confident that you're not ovulating. It's more than 99% effective based on the data if used consistently, and it's about 98% when it's used most of the time. The calendar method is strictly just saying, okay, it's the first of the month. We're not going to have sex on day 14 to 16 because of my consistent fertility past history. There's not a lot of hard data to show is it used consistently correctly. If it's used once in a while, it's about 85%. So it's very similar to the withdrawal method. And so it does decrease the chances, but it's not 100%. So the withdrawal method, coitus interruptus, it's keeping the sperm directly out of the vagina and being able to go to the ovulation and cause conception. So it's definitely something you can utilize, but you have to have the right partner. You have to feel comfortable. You have to be aware that pre-ejaculation can have some sperm in it. So if used consistently, it's a great option 96% of the time, but you know, we're human beings and sometimes they don't get to pull out in time. There's more pre-ejaculation. It's it's an option, but eventually you're going to get pregnant. So the advantages and disadvantages of natural family planning. Natural family planning can be used to help with pinpointing and being fully aware of her body. We're all about, as midwives, women understanding their cycles, their menstrual flow, what is ovulation, having a little bit of advocacy and power over fertility and having children and not having children based on their goals. So it's really getting women to teach them, when is their cycle start, when was their last period, watching for signs of ovulation. There's great apps out there nowadays, and then just avoiding pregnancy when you're fertile. Anyone that has medical conditions, anyone that has a hard time getting pregnant, doesn't care so much if they get pregnant, someone with irregular cycles, this probably isn't a great option for them, but just making them aware, it is one of the choices. So the biggest advantage is a lot of women just don't want to take hormones. They don't want something manipulating their body. They don't want a Paragard. They don't want something foreign inside their uterus. They don't want a string. They don't want to deal with the procedure risk. It's simple. They don't have to go to a doctor. They don't have to get a prescription. They don't have to see a provider for any reason. It meets many of the religious affiliation options for birth control and helping to space children out. It's obviously cost saving because it doesn't cost you anything versus a Paragard, condoms, diaphragm, Nexplanon, all these other options. The challenges with the natural family planning option is it's difficult to estimate sometimes. It doesn't work for every woman. If you don't have consistent cycles, have a great app, you can consistently keep an eye on your fertility and really in tune with your body, it's just a harder option. There's not as much effective data out there as other forms of birth control, so it could widely range from 80 to 100% effective. Some women choose to buy ovulation tests, and that can get expensive over time if they're not as comfortable telling the signs and symptoms of ovulation from their body. And some couples just don't like the idea of not being able to have sex at certain times of the month. If you're a busy family and it's a rare opportunity and this is the fertile time, it can be sometimes a challenge in attention with intimacy and the marital status. So just as a high-level summary, there's many contraception options available to help prevent pregnancy. Some are hormonal based, some are barrier methods, some are natural family planning options. As providers, we must learn all these different options and be able to give informed consent and the risk-benefit analysis that best fits our clients we're serving. We need to be very familiar with natural family planning, and it is a great option for certain women in certain situations. And so we just want to be able to be comfortable and confident that we can educate them about natural family.